Hello everyone, my name is Carly Deck and I will be talking about the impact of injury on both athletes and sports exercisers. Specifically, why do athletes play through sports pain and injury and what gives them persistence? Athletes and exercisers performing at any level have an increased risk of injury because of training and athletic physical movements. First, let's talk about passion and sports ethics. Madrigal et al. 2015 talk about their research findings, which is that most of the athletes' reasoning behind playing through an injury falls into either category passion or sports ethics. For passion, athletes say they love the sport and did not want to stop, or the meaning of the sport is too important for them to stop, or that they have a big desire to be on the field or court. For sports ethics, athletes say they play such a big role on the team if they were to temporarily stop playing, they would not be helping the team, or that they would be sacrificing game time, or lastly, that they have accepted they are injured but continued to play. Another reason for athletes and exercisers to continue to play through pain or injury is due to a social influence. Social influence is the way people change their behavior based on others in their social environment. An example of this can be peer pressure. Kabiri et al. 2021 found in an experiment that there is a positive correlation between social influence and playing through pain or injury. Furthermore, athletes have coaches, teammates, friends, and family in their life, and if they encourage the athlete to play through pain and injury, the athlete is more likely to make that decision to play. These findings show how social influence can quickly persuade an athlete's decision making. This encouragement to play through pain and injury can lead to the pain worsening, as well as physical and mental issues for the athlete. The final reason for athletes and exercisers to continue to play through pain or injury that I will be talking about is gender. Past research shows that there are gender differences between athletes and exercisers handling pain and injury. An example of this is that males are more likely to play through an injury compared to females who are more likely to take time off to recover. Weinberg et al. 2013 mentions that new research is showing that females are adopting the thinking of a male when it comes to injury. Females are minimizing pain in a masculine way. And to add on to this, the author shares that the gap between genders is closing when it comes to pain and injury and how they deal with it. Weinberg and Gold 2024 bring up this topic as well. They say that athletes internalize aggressive masculinity when playing through pain and injury. This shows the final factor as to why athletes participate and persevere through pain and injury.
Hello everyone, my name is Emily Maddux and I am here to speak about a couple more issues regarding injuries and their impact on participation and persistence in sports and exercise. My first topic today is adherence to protocol, and this does apply more specifically to athletes, but it can be applied to exercisers as well. So adherence to protocol is really referring to a situation in which someone who sustains an injury is working with a health professional, say an athletic trainer or doctor, specialist, what have you, to develop a protocol or a plan for recovery. And typically the goal in athletics is to get the athlete back into the game to be able to perform at the same capacity they were able to before the injury. But what we actually see in some athletes is non-adherence to their protocol. So what that means is for a number of reasons, athletes may not follow the protocol that they're placed on. And some of the reasons that were outlined in the text by Weinberg and Gold that we're using in this class right now is pressure to return to play. The athletes feel like they need to get back into the game. It was stated that some athletes actually fear losing their scholarship if they are athletes on scholarship. They fear losing their starting position. If they're injured, someone else may be in their position and actually take their position. Or they simply may not be taking rehab seriously. They may not understand how important it is for recovery. Please excuse the background noise. So a study by Clement in 2008 applied the trans-theoretical model to try and understand why athletes aren't adhering to protocol. The trans-theoretical model is a model used in psychology to investigate how people adapt to new behaviors. In this case, the new behaviors were considered as new behaviors that would be associated with recovery. So going into treatment every day or refraining from exercise, stuff like that. Clement actually concluded that the trans-theoretical model could be a very useful tool for coaches, trainers, health professionals to determine if athletes are ready for rehabilitation procedures in the first place. Deciding whether an athlete is ready for the protocol in the first place may yield better results in actually adhering to the protocol. The general basis of this study was that an athlete who is ready to adapt to that change will be more confident that it's going to help them heal successfully and get back into the game. The next topic today is coping with injury. If athletes are not adhering to the recovery protocol which they are placed on by athletic trainers or other health professionals, they may be employing their own coping mechanisms, which are not always the most effective in recovery or the most safe. We know that athletes are often socialized to believe that they must push through pain, and they often overtrain as a result of this mentality, which can cause a considerable amount of pain even in athletes who are not injured. This has led to the use and often misuse of nonsteroidal anti-inflammatory drugs. And actually, a study by Reed et al. Found that the use of nonsteroidal anti-inflammatory drugs, NSAIDs for short, was pretty socially accepted by professional footballers. And actually, the misuse was socially accepted. The issue is that the misuse of these NSAID drugs actually has some risks associated with it, namely renal, gastrointestinal, and cardiovascular risks. While these may not pose an immediate effect on the athlete, they are important in considering the long-term health of an athlete. So considering all of the issues that Carly and I have outlined in this presentation, what are some of the measures that coaches, athletes, and athletic trainers can take to sort of mediate these issues? Well, there's actually some signs of poor adjustment to injury that all the people around the athlete can observe. These include obsession about returning to play, and especially obsession about questioning when they can return to play. Additionally, feelings of denial, guilt, rapid mood swings, and withdrawal from others, especially withdrawal from people that matter the most to them. And a general negative outlook on the recovery process. These are all signs of poor adjustment to injury that people around the athlete can notice and take action on. So a study in 2014 actually found that 80% of injured collegiate athletes relied on social support from athletic trainers. And growing evidence actually suggests that social support is a huge positive factor in recovery from injury. In other words, athletes and exercisers who have that strong support system are more likely to recover successfully from their injury. This study by Yang and colleagues really just highlights the critical role that athletic trainers play in the physical and mental aspects of recovering from injury. Coaches can take this information and really encourage athletes who are injured to develop a positive relationship with their athletic trainers and to just go see them. This really aligns with the adherence to protocol that we spoke about earlier. Athletes who are adhering to their protocol are most likely seeing their trainers or other health professionals often, typically day in and day out, to recover from their injury. And so it makes sense that athletic trainers are able to provide that social support that is so crucial in helping these athletes recover from injury.